Hi everyone, we're here with Dr. Kelly Faber and Dr. Sarah Cates, who are joining Christian Health Service Corps to do kind of a special program. So I wanted to let you guys describe it because I think that would be a whole lot easier. And you laid out such an amazing vision to me about, what does it look like to have really good quality care for those in need. And I like your vision, I love your vision, and I wanted you to share a little bit about it and maybe tell the folks watching what that's gonna be.
Sure. So I've been on the mission field since 2011. Started as a post-resident, entering a hospital where a good environment for me. I think I was the only pediatrician, but that allowed me to kind of see what could be possible at a place and introduce some things alongside great things that were already going on. And that was at a southern hospital in Togo. And 2 years later, I was able to be part of the opening of a hospital. So you get to make your own rules a little bit and kind of set the groundwork for what care is going to be like. And during that time up until now, I think we were really able to bring quality care to an area that needed it, that was very underserved, the catchments area of about 2 million people, and say, how can we not just meet basic needs, but how can we push the care to say that we don't just want low infant mortality, we want preemies to live. We don't just want kids to survive from malaria, but we want them to survive cancer. And saying what could be possible using local people, using expat workers, and trying to marry that. Meanwhile, the hospital also had a great mission to let Christ be known and to say, hey, we love Christ, we love Jesus, and so we want to bring that message of Christ to you. And missions hospitals around the world want to do that. That's a goal of missions hospitals, to say, how do we bring the message of Christ, who used compassion and healing to these vulnerable groups while bringing the message of who he was.
Yeah, my name's Sarah, and I'm emergency medicine trained by training, and I worked about 4 years in the States before I went to Togo. Sure. I've been in Togo for about 5 years as well, at the same hospital, obviously, and I think I'm a poster child for if it can happen, because I started out in emergency medicine. I was very scattered as far as I know a little bit about everything. I can take care of a lot of different things. But preemies and really sick kids and things like that was a lot out of my wheelhouse when I got there, to be quite honest. And which I think a lot of physicians find themselves in that boat when they get on the mission field, and all of a sudden it isn't quite how they were trained, and it really isn't quite what they were expecting. And the learning curve just becomes so steep, and my learning curve was really steep. And I asked a lot of questions, and I put in a lot of time and tried to elevate what I could do to help. And I do a pretty good job at pediatrics and neonates now, and I think I was in a hospital in a place that cared about that, it cared about quality, it cared about seeing the best care being given, and it makes you want to do it, right? It just makes you want to get there and to say, we can do this better. Well, what else is next? Let's try that. And I think we both kind of have the personality of kind of pushing the boundary a little bit of what else can we do? What else can we do? We're not giving up. What else is better? What medicine can we get? What procedure could we try? Sure. What could we offer to make sure that when people come and they entrust their lives to us, that we don't take that lightly, that we say, let's do the very best that we can for that.
That's great. So now both of the hospitals in Togo were really established by ABWE.
Yep.
And you guys were there, but I guess people might ask the question, well, why are you leaving there to come to Christian Health Service Corps? So I think that's worth answering, so that, because they do a great job there. They do great work.
They do.
But I thought I would ask you that question, because we have a lot of respect for ABWE and the work they're doing there in Togo.
Yeah, for me, I I love clinical work. I love bedside medicine. I love being a part of it. But for me, I also kept receiving phone calls from different sites or different, hey, I saw a picture of your preemie who made it. Babies under 32 weeks don't make it here. What are you doing? And so, and loving the partnership to answer questions and, okay, this is what we're doing. And you can do it too. Sarah mentioned we always want to go next level, but that next level also has to be within certain hospitals' resources and what's available to them, what a family can pay for. And so I loved being able to step into that for other physicians that had a passion, had a love, a compassion for the people that they were serving, but they just didn't know what to do next. And to be able to give them tools where they didn't have to buy anything more. They didn't have to do a financial campaign for raising. They just needed certain tools to say, hey, I'm willing to be here. This is the set of skills I have. And I just need to be up-trained to be able to do that. And for me, as more and more of those calls came, right, I mean, that became the passion that I love what Togo does, but how sad if other hospitals are losing 33-weekers when they have the resources already where they could live. And so for me, it just was about the next step for me that the Lord gave me 10 years on the field at this setting in this hospital, but now wanting to use resources that I have, knowledge that I have, willing to gain more knowledge in order to be in a position to equip other people to advance care where they are.
Sure.
Yeah, I mean, I think a lot of that is what I would say as well. I mean, I think when I came to Togo, I came right after the hospital opened, and I stayed and came back because I saw that it was a hospital that wanted quality. And I'd been to a lot of places in the world, and it's not that way everywhere, and it's not because they don't want to, it's just because maybe they don't have the resources or have exactly what they need to have to move the needle, as Kelly said, to go the next level. And being able to be in Togo and to see that happen and to see that good quality care is possible in rural Africa. It really is. I mean, we prove it every day there. The team there does. And what an amazing thing to see just missions hospitals around the world just tick that level up just a little bit as a testament of who Christ is, of who the person is, the patient is that, they are made in the image of God. We are here to serve you as best we can, and we're going to continually try to strive to be the best that we can be. And it is possible. We've seen it very practically. And as Kelly was mentioning, most mission hospitals just don't have the resources or the time or the staff to think about what those next things are. So I think it's such a unique and amazing opportunity for us to step in and say, if you're willing, we're willing to come alongside you and help you. We're willing to come alongside you and help you make whatever better, if that is preemie care, if that is anything. We're willing to be that legwork and to be those people that can help you to do that better.
That's great. Well, it's an exciting program. We are very excited to have you doing it with Christian Health Service Corps. We work in we partner with about 30 different hospitals. And of course, we have a network of probably much bigger than that who will be seeking you out, I'm sure. But I know that, between Christian Health Service Corps physicians and healthcare professionals on the field and even the post-residents that are out there,
Sure.
You guys are all networked in, and just that additional set of eyes, and sometimes an outside consultant, I can see being really helpful to just, when one person is trying to say, we really need to do this, but nobody's buying in because nobody has the time to look at it, having a couple extra outside eyes I see would be so valuable. So thank you for doing what God is calling you to do and put on your heart, and thank you for doing it with us. We're excited to have you.
We're excited to be here.
Very excited, yeah.